wondered if you should be doing Kegels? You're pregnant or you're postpartum and your provider told you to do Kegels multiple times a day to get ready for birth or to recover from birth. But you've seen mixed information on the internet and on social media and now you're confused. I get it. Hi, I'm Dr. Ryan Bailey, a pelvic floor physical therapist and pregnancy and postpartum specialist. I'm here to help you clear up that confusion. First, let's talk about what Kegels are. A Kegel is an isolated contraction of the pelvic floor muscles that help you stop the flow of urine or hold in gas. However, the pelvic floor is part of a whole system and has many more roles than stopping pee and holding in gas. And so doing an isolated pelvic floor contraction may not be the best way to strengthen your pelvic floor. Now, as a pelvic floor physical therapist, I do advise some of my patients to work on controlling the pelvic floor in an isolated way because they have very limited awareness of those muscles. And before we get into more complex movements and complex exercises, we need to make sure that they have a good connection to those muscles. However, if that is already there and you need more control of them, there is an exercise that has been shown to be better at strengthening the pelvic floor than Kegels alone. And I want to show you that today. What you'll need is something to squeeze between your knees and something to hold in your hands. This could be a paper towel roll. It could be a small foam roller like this. It could also be just a pillow. You also need something to put your legs up onto to start off with. This could be a couch, a chair, a more advanced way is to have your feet up on the wall. So what we're going to do is you are going to lie on your back and we're going to put the block or a paper towel roll, something between your knees. So let's start doing that. If you are pregnant, you may want to put a pillow or some blankets underneath your back and your head to create a little bit of an incline, especially if you are past your second trimester. So we are going to lie on our sides and then roll onto our backs to begin with and place our legs up onto the surface that you are using. You can place the block in its longest way, its medium, or its thinnest. This is going to be the most challenging, medium challenge, least challenge. So you pick which one is going to work the best for you. Let's go into the medium here. And then you want to grab whatever you're using to hold in your hands. So this is a multi-step exercise that really makes you have to think about what you're doing because there are steps to it. So the first step is our inhale. Because our pelvic floor works more like a trampoline where it moves down before it moves up, we actually want to focus on our inhale before we think about any contracting of the pelvic floor. To help us with our inhale, we are going to hold our arms up towards the ceiling and we're going to reach our arms towards the ceiling. And that helps us breathe into our back. So what we want to do is reach towards the ceiling, expanding or sliding our shoulder blades wide across our back. And that is when we're going to inhale. So we can soften our shoulder blades and then inhale. As we reach, you should feel more expansion into your back, keeping your pelvic floor and your belly soft. Then what you're going to do is when you exhale, you're going to want to maintain that nice expansion in the ribs as you squeeze the block between your knees. And then think about turning the pelvic floor on. So you want to think about stopping pee, holding in gas, and then drawing the bones at the bottom of your pelvis up and in From there, you want to start to zip up the abdominals. So you want to feel a flattening and a drawing or scooping in of the lower belly just above the pubic bone. And as you do that, your ribs in the front are also coming down towards your pelvis, meeting that zipping up from below. This is what I mean by a multiple step exercise. Even though there isn't a lot of movement, there is a lot of thought process that goes into it. Okay, so let's start that again. So you are going to inhale and reach the arms towards the ceiling so that you get a nice big expansion of the back and side ribs without clenching in the chest or tightening the chest muscles. So keep those chest muscles nice and soft as you do this. Then you're going to exhale, you're going to squeeze the block, and you're going to think about hold in P, hold in gas, draw the bottom of the pelvis up and in, and then zip the abdominals or scoop the abdominals from the pubic bone up and in as your ribs move down towards the pelvis, meeting that zip. And then let it all go on inhale and repeat. Great. Once you have that, then we can actually start to add in a little bit of a pelvic lift. This isn't a full bridge, it's a little bit of a pelvic lift, and that also gets our glutes involved. So next step is adding in that lift. So you're going to inhale, reach, exhale, squeeze, close, scoop, zip, and then gently lift, feeling those glutes kicking in, but you are really squeezing that block so you are not tucking excessively, you are not feeling your knees kind of drop out like this, and then you're gonna lower back down. So inhale, reach, exhale, squeeze, scoop, zip, and lift. Fantastic. So I'm going to set this back down. I'm going to roll off to my side to sit back up. So as I said, that is a multi-step exercise. So you have to think about each step. And if it's really hard for you to squeeze the block, just start there. Then add in the pelvic floor, then add in the abdominals, then add in the lift with the glutes. Each step adds on to the next, and that layering effect helps that whole system come online together before you start to add in a lot more integrative exercises that require the pelvic floor and the pelvic core system to respond in a much more proactive or reactive way rather than feeling heaviness, leakage, or pain. So if any questions, drop them in the comments. I'm going to be adding on more videos about what exercises you can do instead of Kegels during your pregnancy and during postpartum to strengthen and lengthen your pelvic floor to get ready for birth and to recover from birth for a more sustainable pelvic health system. Thanks for watching. Have a great day.